Hi, my name is Jasmine Solis. I'm an MFT6102. This is my week 10 assignment where I'll be discussing systems thinking and psychopharmacology. I have two questions to discuss. The first one is, what key principles should MFTs use to guide their approach to psychopharmacology with clients? My answer to that is every MFT has a set of recommended guidelines to follow when assisting clients when there is a decision to be made on whether or not medication should be utilized. These recommendations are constructed from the following: information gathered, understanding the client's problem, plan of care for the client, and collaborative work. Information gathered will consist of gathering necessary information from systemic assessments that are done with the client and the family of the client, where it'll provide the client's issues, information from all those who are involved in the client's life, such as parents, family, friends, school officials, anyone who has direct contact with the client on a daily basis, and knows of the client's situation and wants to be involved in helping the client with their therapy. You would gather information from all of those sources. Understanding the client's issues. The information that is obtained needs to be reviewed by the therapist, and additional research should it be needed in understanding the issue at hand, should be conducted. This will benefit not only the therapist but also the client, because the therapist will have the ability to comprehend the problem and know what tools to utilize in helping the client and their family. This particular issue is very important for a therapist to show that they understand what the client is going through, because the client wants to feel safe and secure with the person that is helping them in their therapy. So if the therapist is able to show that empathy and understanding, the client will be more inclined to release further information regarding the issues that are bothering them. Then the therapy will be a success, because the client will feel safe with that therapist, and so will the family who's helping the client and the therapist as well. Plan for care for the client. Utilizing the information gained from the assessments and the research will allow the therapist to sit with the client and come up with a plan of care that is tailored to the client's specific needs, and allow the client to be successful at completing the plan to provide a more quality life for the client and their family. This is important because you want to show the client that they are very much involved in their therapy and how it's going to go. And you want to make sure that you're tailoring it to something that is going to be successful for them. You want to make sure that you're pointing all aspects of therapy towards their strengths, so that way they will see the progress as they go. And you also want them to document that progress as they go, so that they can have that sense of completion, that sense of success in their life. Where most clients lack that feeling, these clients will be able to have that because you are providing that avenue for them. You also want to include the family in the planning of the care, because you want to let the family know what needs to be done on their part as well. That's where collaborative work comes in, is because you're using the entire family system, not only just you and the client, but also the family that's involved. So anyone close to the family, to the client, just like I said before, school officials, anyone who wants to help the client reach their goals, you'd want to include them in the process so that they would know what they need to do. You have to also keep in mind that therapy is only 30 minutes to an hour once or twice a week. So the remaining time that the client is outside of the office, they're going to be with those family members, with school officials, with friends, and you want the therapy to continue outside of the office as well. So it's very crucial that you include them in it so that they know what exactly they need to do, how they need to do it, and they can also provide notes on the progress of the client as well. So it would help in finding out is the client successful at this particular task? Is there something else that needs to be done outside of the office that may be useful to the client and their family? Because the client is not just the individual, the client is the family system. It's the whole gang included. So you want to make sure that everyone is on the same page and following the same guidelines to reach the same goal. Question number 2 is, how could MFTs take a proactive stance with respect to the limitations and benefits of drug therapy? An MFT has a responsibility to educate their clients and family on drug therapy, providing them what the pros and cons are, the side effects that should occur, and the outcome or that could occur, and the outcome of the medication. Additionally, MFTs should provide research results on such medications so that the client can take it home and think it over. Before an MFT suggests drug therapy, they should look into other tools that can be utilized before going the medication route. Sometimes all that is needed is to show the client another way. Medication is not always the top thing that you jump to when you want to start therapy, because they should be able to deal with their struggles without being on medication. Medication should be the last resort once all other things have shown not to work. Once the therapist has provided all the information needed on such medication, they should allow the client time to discuss it with their relatives and see if this will be a good fit for them. There are alternatives to medication, and it is the responsibility of the MFT to also inform the client of those methods as well. This will provide a great line of options for the client to choose from. Alternative methods can consist of meditation, massage therapy, herbal supplements, various tasks that can put focus on things that the client enjoys, such as art, music, dance, writing. The key aspect is to know that the medication should never be the first step to be taken when there are so many other unharmful ways to get the help the client needs. Should a client opt for medication but has expressed a financial hardship or difficulty, the therapist can always help find them a lower cost avenue, such as online coupons, utilizing generic brands, or seeing if there are any study or research trials occurring that the client can benefit from. The client will not only be thankful for the information, but they will also be grateful that you, their therapist, took the time to initiate and gather all the information they needed to make an informed decision. It's always a great thing when a MFT can assist their clients beyond the therapy sessions. Not only will you build a trusting foundation, but you will also be helping save a life. When it comes to medication, it's always best to make sure that you've covered every avenue. And I can't stress enough that sometimes doctors are quick to just jump to medication first without thinking of other things that they can do. I'm big on journaling and writing down all of the things that are going on with you so that you can see where you are at that moment and see where you've gone. There are so many other methods than using medicine first, but if medicine is the next resort and it's something that we can't avoid, then it's best to give our clients the best information and all the information that they can possibly need to make that informed consent. So that's it for my week 10 assignment, and thank you so much.